Next up, we've talked a lot on this show about inequities in healthcare, including financial barriers and racial disparities in care, with patients of color often treated with less urgency and understanding than their white counterparts. But there are also major disparities for the people doing the caring, particularly when it comes to surgeons. A 13-year-long study recently published in the Journal of American Medical Association found that there is, quote, underrepresentation of Black physicians at every stage in surgical training. And Black men are especially likely to be missing from this profession, with their graduation rate from U.S. general surgery declining in those years, while application rates have gone up slightly. It is part of a larger problem that Dr. Robert Higgins has seen firsthand for decades, first as a surgeon, then as surgeon-in-chief at Johns Hopkins Hospital, and now as the president of Brigham and Women's Hospital. Dr. Higgins joined me earlier this week to dig into the disparities and how he plans to address them at the Brigham. Dr. Higgins, thank you so much for being with us.
Well, thank you for the invitation. Really an opportunity for me to spend some time with you. Thank you.
So what was your journey into surgery yourself?
Well, I was blessed. My dad was a physician. He passed away early in our lives, but my mom kept that image of what we should do and how we should accomplish, and created a great environment for us for scholarship and participation. Kind of kept us out of trouble, my two brothers and I. So I always knew that I wanted to be a physician, and then got the opportunity through lots of great sponsorship and mentorship and an educational environment that gave me the opportunities. And so my path has been moving forward in that direction, and here I am today. Surprised as I am to be at a place like Boston, in a fantastic institution, hopefully leading others to find their way in this career as well.
Well, I want to ask you about that, because what were some of the challenges as you were trying to get into this profession and now, leading one of Boston's top hospitals?
Well, it was all about academic preparation, and then showing that you could do the work, and then preparation for the rigors of training, going to medical school, and then going through the general surgery training. I grew up thinking I wanted to be a transplant surgeon, and ended up in the cardiovascular space, so I did a heart and lung transplant, and that's how I kind of blazed a trail, as it were, as one of few African-American men in the field. I had an opportunity to be a role model. I had great mentorship and people who sponsored me. And I think the opportunities were obvious for me. I had to perform at a very high level along with my peers who were in the majority, but I was really blessed to get those opportunities. And now I think it's paid dividends as being here at one of the great institutions in America, and actually around the world, the Brigham and Women's Hospital and the Mass General Brigham system. So I feel honored to have been here to lead these programs, and I have to reach back now and help mentor and sponsor young people who want to follow in those footsteps.
Why do you think, we mentioned the decline from this JAMA study, why do you think the number of Black surgeons, especially Black male surgeons, is declining?
Well, I think it's in all of medicine. Many of the persons of color who don't have opportunities to get early educational reinforcement, the resources they need to be academically prepared, whether it come from high school to college to pre-medical curriculum and then into medical school, they just don't have the kind of the support that they may need to be successful in the reinforcement. They certainly have the ability and the aptitude, but it's all about kind of mentorship and sponsorship. And so if they don't get those resources, they don't find that path. And I think compared to law or business, even finance, I think it's a shorter path. It's less onerous, maybe. It took me 9 years to go through my surgical training from graduation from undergraduate experience. So that's a long time. I had a significant financial debt and had to pay that back before I got my first job at age 34. So that's a long time to train and to be kind of in preparation for your career and your future. And I think that's part of the obstacles that I think young persons, particularly of color, face.
And there's a shortage of doctors, across the country.
Absolutely.
Yeah.
I mean, we need to reinforce the importance of physicians in dedication to their communities. That's really, really an important part of the equation for all physicians, primarily in the primary care, but also in the specialty areas. But these are challenges that we all face, and we have to do our best to kind of invigorate the environments. I think one of the challenges, of course, is the destination has to be pretty special. And we're trying to create a more diverse and inclusive workplace so that persons of color who come into medicine feel like they're welcome there. And that's part of my job, is to make sure that the Brigham and the Mass General Brigham are welcoming for physicians who would come from diverse backgrounds.
And we know that the data supports that if a doctor, a nurse, or someone in healthcare space looks like you as a patient, you feel more comfortable in talking about your symptoms and working with that doctor on a treatment plan. So is that why the focus on diversity is so important?
I think it's critically important.
Yeah.
I think creating some role models to follow in the footsteps makes a world of difference to a young person looking up to somebody and saying, I can be that person. But you can't be what you can't see. And classically what happens is our role models, as laudable as it is, don't look like people that come from your community. They don't look like folks that you would spend time with in a social setting. And so it's hard to follow in those footsteps. So I think if I can be successful and prove that someday an intern or a resident who's working through the process could grow up to be the president of the Brigham, well, then maybe we've blazed a trail.
What are some of the things you're doing at the Brigham to help create more of that inclusive space among staff and, that patient care that you're looking for?
Well, it really is about making people feel welcomed in the environment. Sometimes these academic environments are not welcoming to those folks who are not in the majority. And so we have to create an environment that nurtures their well-being. They have to feel like they're included and valued in that space. So we're doing a lot of programming through the Center for Diversity and Inclusion to make people feel like they have a place at the Brigham and at the Mass General and all of these other institutions, Johns Hopkins. That really is a big deal. Once they feel like they're welcome there, then they can excel, they can kind of grow, they can develop. And if we take them along the way, we can teach them how to be great physicians. They can take care of a diverse patient population and really make a difference. And so that's the challenge, but it's not going to happen overnight. We had a program in Baltimore. We were teaching young people preparing for college. So they're taking their SAT preparation so they can get into college, and then that's 4 years of college, and then they go 4 years of medical school, and then general surgery training would be 5 years, or medical training would be another 4 or 5 years, and then specialty training for a cardiac surgeon is another 3 years. That's a long time, and it's a huge investment of time and energy, and expensive. And so I think that's one of the challenges we have to overcome, is the socioeconomic challenge of getting into the medical field and then training and then feeling like at the end of the rainbow, you're going to cash in, so to speak, and have a fruitful career. You can do great things. You can take care of patients and really make a difference in the world.
What external forces need to sort of be rallied? Is it more state funding for STEM programs? Is it more affordable colleges? Is it what external factors could help with your internal work at the Brigham?
Well, I think these young people are taking on a huge debt. You know, my son had well over a six-figure debt, which he's now paying back. We're helping him out, of course. But even people of means still have to spend an incredible amount of time and energy to get to that destination. And I think if I came from a single-parent home. We didn't have resources to kind of spend on big educational expenses, so we borrowed student loans. So I think the federal government tried to kind of reduce the stress on federal debt for medical students and pre-medical curriculum. There's some resistance to that, I guess, across the country. But I think that's one way to help promote young people to pursue the career so they don't have to take on a six-figure debt to get there. I think creating opportunities for them as they're training, helping them feel like they are, again, welcomed in that environment, changing the culture of medicine, which is more welcoming for persons of color, black and brown, as well as women, to make sure that they have an opportunity to feel like they can grow and develop in those spaces.
Dr. Higgins, thank you so much for your time.
I really appreciate it. Thanks for the opportunity. I look forward to doing great things with you.